the fact that I have been working with and supporting people that are struggling with addiction through the pandemic almost makes it a little bit of a cloudy question for me when I think about how the pandemic impacted drug poisonings in people. I'm sure that there are. I'm sure that there are some people that kept track of that sort of thing, but I can tell you that what I saw was sadly not a huge difference if I'm looking at now and then. There wasn't and still isn't a lot of support for people that are struggling with addiction. There's not anything that happens quickly or, to be honest, kindly to help people that are struggling with addiction. And I didn't see a huge influx of trying to help people through this pandemic in a healthy way so that there weren't going to be drug poisonings. With that being said, what I did see was that people were being brought together. People who were without shelter and experiencing addiction were probably much safer because they were in group gatherings where there were people who had naloxone handy to save lives and where they had each other to depend on to help each other through. I can tell you that the drugs are getting worse and the poisonings are getting more and more often. So if people were being forced to be alone and use, I mean, we know this. If you're alone in an apartment and you're using, you can't use naloxone on yourself. And we see it even now, people that try to hide out in bank vestibules to use, and they die alone because there's nobody there to help them. And so there's a lot that's been said about alcohol use during the pandemic. I feel like people paid a lot of attention to that. There was a lot more liquor being sold. There was a lot more liquor being consumed. And there were a lot more people that had trouble dealing with either a pre-existing alcoholism, or some people became rather dependent on alcohol through the pandemic. And I think that that's probably been a little more studied than drug use or poisonings. But I do feel that one of the sad things about it is that I don't see much of a difference, to be honest. I don't feel like people are panicking, and I don't feel like our government or, any of the communities around us are panicking about what's happening to people who are dying way too often from drug poisoning. I feel that there was a rush to make sure that people were kept off of buses and out of public places, to be brutally honest, but not to be kept safe. I think that safety is in numbers, not in being left alone with it. But I think that what needs to happen is that we need to be looking at the drug poisoning crisis as its own pandemic, as its own crisis, as something that needs to be dealt with and cared about and worked on, and just as much as any other thing. People are dying. They're dying because they're not getting the help that they need for the mental health issues that they're trying to deal with, because they're not getting the help that they need to try to get sober and well, because they can't even keep themselves housed so that they can try to begin to deal with their problems, because they can't feel safe enough to try to start over again. There's no security in housing. There's no security in food. There's no security in income. There's no real general consensus that there's a kind and caring government out there for these people that really cares what happens to them. In fact, quite the other way, I feel like there's a general feeling that people just want them to go away. And sadly, unfortunately, they will. That's the sad truth. Pandemic or no pandemic, you cannot just ignore this and hope that it goes away. And these are not strangers or others or people from other towns or cities or people that don't belong in society. These are your friends' children. These are your store owners' children, your restaurant chef's children. These are your doctor's children. These are people's fathers and husbands and mothers and sisters, and they deserve to be cared for, and that's not happening. So some compassion and some real action is what needs to happen.